I'll try to explain a little, which is over mobile phones, and the campaign was on maternal and child nutrition and based in rural India. Okay, so the partners in this program, the funders, the primary funder was the BMGF, the Gates Foundation. This PCI was the, I mean, Gramvani, since it's a social enterprise, it can't, I mean, it doesn't get grants as such directly. So PCI subcontracted part of the work to us. PCI was the primary grant receiver. And this is Jivika. Jivika is the what would you call, the livelihood mission in Bihar, the rural livelihood mission in Bihar. So it's called Jivika. It's very active. It's present in most villages in Bihar, and they have a very good network of women self-help group. And I'll try to motivate why we work with Jivika. Okay. So moving on, then the second slide is a little. We just try to put into context why do we even need to work on maternal and child nutrition. The primary reason is that the maternal and child indicators, the primary indicators for the well-being of mother and children, that's infant mortality rate, the maternal mortality rate, the under 5 mortality rate, the birth weight, the stuntedness, the wastedness, anemia, vitamin deficiency, all of these tend to be on the higher end in India. And the reason I try to compare India and Bihar is because Bihar is where we did this work, and also because Bihar stands out in, or tends to be on the negative end of the spectrum when we talk about human development indicators, including maternal and child health and nutrition. Okay, so at any point, if you have doubts, I think because we have a good communication as of now, so you just can stop me and ask questions. Okay, uh, then moving on. Uh, in this slide, I try to motivate what is behavior change communication and the problem statement, and what are we doing differently from other people. Okay, so I mean, when we talk about maternal and child nutrition or health, so one of the problems, and there are many reasons, right, why maternal and child nutrition is a problem in India. One of the reasons is the affordability, that there are, of course, families which cannot afford good nutrition, and therefore the mothers, young mothers, pregnant women, or the infants are not able to consume or access good nutrition. But then there's another problem, that is of the behavior or the mindset or the societal setting that we live in, right? So India is, rural India especially, is a patriarchal society, right? Where even if there is sufficient food or nutrition availability in the house, the younger women or the housewives or the younger mothers tend to get the last share of the nutrition or the food, right? So usually the men folk, the male members of the house, they eat first. They eat the bulk of the food that is available, and the women folk, they eat last, and whatever remains. And that too, if it is a girl child or a woman, young woman who's just married into the family, that's the segment that is neglected even more. And uh, and that is a very behavioral thing, if you, or a societal thing, that if you come to think of it, right? So we're trying to attack this problem, where we're trying to build awareness, and we're trying to build a behavior change at the household level around these practices. So and using some kind of a communication mechanism, right? So if you are talking about behavior change or awareness, you have to do some effective communication. So then that brings us to something called the SBCC, okay, so social and behavior change communication. Okay, and so there is a lot of SBCC which happens on around, sanitation or diets, right? So if you see the Lifebuoy ads, right, so that's like an SBCC where Lifebuoy, as a commercial entity, no doubt, but it's also trying to promote that you have to wash your hands before you eat meals, right? Then there are other SBCC campaigns, the Pulse Polio the campaign, right? The Pulse Polio vaccination, where there's a very strategic, very planned out, and very targeted campaign that every child under 5 should go to the Pulse Polio booth to take the vaccination whenever there is a camp, right? So these are all behavior change campaigns. So therefore, you see that It requires careful planning and segmentation of the users. It can go over the TV, the radio, or the print, or it can also happen over personal channels. As in, a health worker might come to your house to convince your parents or any parent that take your child to the pulse polio campaign next Sunday, right? And it can also happen through focus group discussions where health workers gather in a community and try to talk to people, right? But then the problem is that if you are doing an interpersonal communication or focus group discussion, you are resource constrained, right? Because it doesn't scale, because you have to do one-to-one communication there, right? And again, TV and radio penetration in rural area is actually not very high, and on the contrary, mobile phone penetration is actually higher. Okay, so can we then use some kind of a participatory media over mobile phones to reinforce SDCC messages? Okay, so that is the setting of the work. Okay, so if you have any questions till now, you can ask me. Otherwise, I'll move on. Okay, then let's move on then. Yeah, is there something? No. Okay, then I'll move on. Okay. Okay, so the premise again is that mobile phone penetration is increasing. It's absolutely not close to 100%, no doubt, but it's increasing, and it's maybe closer to 70 to 80% of. And again, it's not a per person, a per head basis. It's a per household basis. So at least 70 to 80% of all households, even in rural areas, have access to one phone. Okay, and therefore, if we are able to leverage phone connections or phone calls, then we'll be able to reach a higher scale. Okay, so other than that, how does it compare to TV and radio? In addition to being the TV and radio penetration being lower than mobile phones, is that mobile phones are on demand. A TV or radio program is not on demand. I mean, it has certain schedules, right? Broadcast times that you have to use. But a phone call, if you are using a phone call, then it's on demand. You can dial a number whenever you want and whenever you are free, right? So this is why we use IVR. Okay, so IVR, I'm sure most of you have interacted with. It expands to interactive voice response systems. Okay, so it's something that you would call Amazon, Flipkart, or a mobile company, or say IRCTC. Whenever you call, there's an automated system which responds over voice to you, and you have to press buttons to interact with it or speak. Okay, so that is basically a crude example of an IVR. So okay, so what we have, or what Gramvani has, is this something called a mobile Vani, which is a IVR based participatory media platform. So how does it work? Is so the technology is ready, right? So all you have to do is set up a phone number and install the mobile Vani package. That means, of course, Gramvani will help you do that. Or usually it's a captive installed within Gramvani's system. And you get to have a mobile number if you want to access it, or you want to set up your own instance, right? And what can you do over the mobile number? You can put a missed call. Okay, so if you press a missed call on the number, the server cuts your call, and there's a callback. Okay, so that way the user does not incur any call costs. The provider, the service provider, incurs the call cost. Okay, and on that you can run any content that you want. So you can put audio messages. Usually it's 2 minutes long, but you can go up to whatever amount of time you want. Okay, people can go forward by pressing 1 to the next message, go backwards by pressing I think 4 to go to the previous message, press 2 to record a comment on a message, press 3 to record a new message, something like you would do on Twitter, but all of this you are doing on voice and over a phone call. Okay, the reason we're doing it is because Twitter assumes text literacy, Twitter assumes internet connectivity, and we're dealing with a population or with a certain demography which does not have access to smartphones or the internet, and are not very text literate or text savvy, so they're not able to interact over text based interfaces. Okay, so other than those interactivity, you can also forward a message to some other phone number. So you can press 5 and enter a 10-digit phone number, and the message will be forwarded in another call to a phone number that you want to forward to. You can also bookmark your own bookmark certain messages that you like. Okay, you can also have multiple channels. So you can have a sports channel, you can have a news channel, you can have a this entertainment channel on your instance, right? And people can go switch channels, go to the next channel, go to the previous channel, and all of this you can do by pressing a button on the dial pad on your phone, right? The 12 digits or 12 keys that we have on a normal dial pad. Okay, so all of those are mapped to certain functions. So there's a little learning curve for initial users and do what, press what to do what, but the all of the instructions are played out on top so that people know what to do. Okay. And because it runs over simple voice calls, you're not assuming any internet connectivity, it scales better. Okay. So but then again, there are this, even in the setting of mobile Vani, where it is running across many districts and many use cases, the constant challenge that we face when running a new instance is we don't know if the target group has access to mobile phones. We have a new project or a new campaign for a new demography, and we actually do not know if they have access to mobile phones. Okay, and even if they have access to mobile phones, okay, do they have the capability to use that mobile phone or in technology? Okay, so you're expecting people to press the 1, the press the 2, or the press the 3 to interact with the system. But in many cases, we find that the only interaction people are able to do over a mobile phone is answer a call, not even dial numbers, just answer a call. Okay, so expecting them to press numbers sometimes is an assumption that is not always valid. Okay, so then I'll move on to the methodology. Okay, so the target group we were trying to target were pregnant women or women with infants. Okay, that was the primary target group. But then we also had also wanted to target men in the family and SHG members. So SHG are self-help groups. We'll just cover that in the next slide, maybe. Just for now, know that SHG members are self-help groups. Okay. So we also wanted to target men and other SHG members who might not be pregnant or who might not have infants. Okay, because it is important that you have an intra-household conversation around nutrition and health to have their behavior change. Okay, so it has to be holistic. Okay, and we're targeting maternal and child nutrition behavior, and we have a content team in Grambani which decides on content strategy and plans content. So what we the primary and this was decided in partnership with BMG, the Gates Foundation, and PCI, that we should target maternal dietary diversity, complementary feeding, and social entitlements, ORS, and diarrhea management. And there are of course reasons why these were chosen. So dietary diversity is important for the all-round nutrition of the child and the mother. Complementary feeding is important to diversify the diet of the children, right? Social entitlements, knowledge about social entitlements, like the Janani Suraksha Yojana, like the Anganwadi system, is important so that people can access the kind of support that the government is offering, right? And we also say that ORS and diarrhea, diarrhea is one big reason for under 5 mortality in India, that because of bad sanitary practices, because of bad nutritional practices, diarrhea takes a toll. Okay, and it's actually simple to prevent and actually cure diarrhea using ORS, proper ORS treatment. So we also chose to use this as the content. Okay, and of course in the methodology we also reiterate that IVR based participating media mobile Vani was the communication channel. Okay, so the next slide is more of a kind of to give you a context of what is Jivika, why are we even working with them, and what is an SHG. Okay, so this Jivika has set up these women self-help groups, usually a group of 10 to 12 households in most villages in Bihar. Okay, so therefore, what it gives us access to is a ready captive audience of women, where we, and if you just appear or we just if you just by a presence in a Jivika SHG meeting, we get access to at least 10 to 12 women in a single meeting, right? So that is like one leverage that we wanted to take, right? Then what do? They have small entrepreneurial ventures. They lend out certain small amounts of money. They have their own cottage industries. So they do their accounting and all of that in the meetings. Okay. So what Jivika does is they have employed what is called community mobilizers. So one community mobilizer or CM looks at around 100 households. Okay. So what Jivika, so the community mobilizers, what they are doing in addition to a lot of other stuff, including accounting, is that they go to the meeting and they try to train people or inform people on good practices or best practices around health and nutrition. Okay, and what this is this is an offline SBCC, that is social and behavior change communication, but through offline medium, through FGDs or interpersonal communication that we were discussing in a few slides ago, right? Then what is Gramvani doing or Mobile Vani doing is that we have some field officers who interact with the PCI, and through the Mobile Vani channel, what we are doing is we are layering technology on top of the offline SBCC. Okay, so and this is learning over the years, and that is also important from an interaction design standpoint, that a technology interaction can hardly replace an interpersonal interaction. Okay, and you'll probably realize that as you go along, right? So we don't want to replace that either, and that has been a learning for us over the years. What we want to do is augment the interpersonal interaction offline SBCC that is happening using a layer of technology. Okay, so the idea is maybe these women's self-help groups are meeting once every month. Okay, but between two meetings, in the intervening period, there is not a lot of discussion on health and nutrition. So can we implement a technology solution which can augment or continue the discussion between two intervening meetings in the 2 months? Okay, so that's the primary aim, that we're not trying to replace the offline SBCC. That has to go on, that is important, and because of a lot of reasons other than just the interaction. Okay, we're just trying to augment that using a layering of technology. Okay, so what we did was we implemented this in 6 blocks in the Nalanda district in Bihar. It's a little backward district. Okay, and so the idea-based participatory media was Mobile Vani, and on this the users play an active role in generating and disseminating content. Okay, so it's on the, so I was explaining the Mobile Vani system a few slides before. So when you press 3 to record a message, that becomes a UGC. Okay, so user generated content. Okay, and theoretically it's more powerful than a mainstream media because it's a two-way platform. If you are broadcasting a polio ad or the live boy ad on a TV, that's a one-way communication, right? You're just the service providers are just informing you, but there's no way for you to interact with the service provider. But an IVR-based media, it gives you a two-way communication. So not only do the content providers from Gramvani or Gates Foundation get to deliver content to you, but you also get to press 2 or press 3 and give back content or give back feedback. Okay, so that's a two-way communication. The content, of course, was designed in partnership with PCI, the Project Concern International, and Jivika. And the formats were mainly drama format, where we had episodes where characters, a mother-in-law, a daughter-in-law, a husband, a child in a house, the daily conversations, the nutritional practices. Okay, and every week we had a new episode, and the story progressed. And also we could have interactivity, right? So suppose the story ends at a certain point, we can ask on the IVR, what do you think the mother-in-law should now do? Okay, or what do you think the husband now should do? Okay, and using that, we can now capture the change in mindset, a change in behavior, a change in perspective for the consumer. Okay, so if we know that one listener has been listening to a program every week, by just capturing the perspectives on different questions, we can kind of map the change in behavior. Okay, other than that, of course, we have infotainment, where there's like information capsules, where it's not a drama, but standalone, maybe through a song or through poetry, we try to convey messages. And of course, information capsules are more drier side of the spectrum, where we just have information without any entertainment or drama or characters or story. Okay. Then what I report in this talk or in this presentation is a 1-year implementation from. Of course, this is still continuing, and we have not done an analysis of what's happening after this. We can if we have the bandwidth. Okay, so starting in April 2017 to March 2018. So there are 4 quarters, and that is what we are trying to report. Okay, and there were around 0.45 million missed calls, 32,000 unique users, and there were 0.24 million push calls. Okay, so what are push calls? Missed calls are where people call, right, the system, and then there's a callback. But there are also push calls, and push calls are, there are strategies we use For the push calls, if we see that a caller has not called for over a month, we try to make a push call so that there's a reminder that you have not called us for a month. Would you like to continue? Okay, some such kind of messaging. Okay, so the scale is quite large in terms of the number of users. Okay, but then in the rest of the slides, I try to document the complexities if you want to do this social and behavior change communication over mobile phones. And I do try to do that around four axes. One is the technology adoption. The second is the content diversification. The third is concurrent monitoring, and the fourth is mobilization pathways. Okay, then I start with technology adoption. So, I mean, when our technology was designed over IVR calls, the one assumption is that people have mobile phones. If they don't have access to mobile phones, they'll not be able to participate. The other the assumption is that people are able to interact over mobile phone. Okay, they're able to dial or press buttons on mobile phone. Okay, but in many of our projects, this has worked well because the primary demography has been male, who kind of have higher ownership of mobile phones. But in this particular project, some of the assumptions completely failed initially, right? Because we find that, and this was done in a formative research, that around only 50% of the women have shared phone usage. Okay, so ownership is much lower, but even shared phone usage in a household, we already saw that only 50% of the women had it. Okay, then the other problem was that, I mean, when we say 50% had shared phone usage, maybe the household has a phone, but the phone is not accessible for the women. So again, it's a patriarchal society where if women start using phones or interacting over phones, then society or the family does not approve of that. Okay, so around 50% of the women were women who had a phone in the household, but they did not interact or they use the phone. Okay, then we also saw that only 80% of the women are able to dial a phone number and make a call. Okay, so only are not even able to dial a number to make a call. So the basic assumption when we want people to use our system is to dial that 10-digit phone number, right, to reach our servers. Okay, so only 20% of the women could do that. Okay, and the third thing that we saw, that the SHG members who were attending the meeting, so the primary access point we had were the Brahmani volunteers would go to an SHG meeting to promote the platform, right? But the people who were attending the meetings were of a older age group. Okay, so there are two problems in that. One is they're not very open to adopting new technology like phone calls. The second problem is that they are mostly over the childbearing age. Means the childbearing age mostly in rural India is much lower, right? So people above 40, women above 40 are usually considered above the childbearing age. So maybe it's not even contextual for them to talk about the child nutrition or pregnancy or nutrition for pregnant women. Okay, so those are the primary two problems that we three problems around three axes when we try to do technology adoption. But what we found, or what the strategy that we adopted, was that we'll conduct trainings on mobile phone usage and will promote a culture of shared phone usage. Okay, so what we did starting from the first quarter till the last quarter is that in every meeting we'd insist that Didi, please bring your phone. Didi, please bring your phone. And over time, we saw that the number of people who brought their phones to the meeting actually increased. Okay, and when they brought their phones, we'd do hand holding, how to dial a number, how to press when you hear press one, then what do you do? Okay, how to interact over the system. So this kind of breaks a lot of assumptions when we build new technology platforms, that technology adoption is natural. In many cases, it is not. There's a lot of groundwork that any organization has to do to even build a culture of technology usage and build the capabilities to use those technologies. Okay, so the kind of numbers we have is in the first quarter, around 40% on an average, women would bring the phones to the meetings. But by the fourth quarter, it was marginally up. 67% of the people on an average would bring phones to the meetings. Okay, and so the bringing phones to the meetings is an indicator of an uptake of culture of shared phone usage, where the women in the houses are also more and more women were trying to use the phone that is there in the households. Okay, This is a graph of the what kind of results or what kind of effects were we able to bring about because of the training. Okay, so on the trainings we would ask them to, of course, interact, press one, press two, but also to record UGC, so user generated content. Okay, and then Gramvani has this editorial policy where there is a big editorial team sitting in Ranchi around a team of 30 people who are trained on to listen to audio content and make a decision, editorial decision of if the audio quality is bad or the content is not promotable. There is, of course, some filtration, like if there is some promotion of enmity between communities, we reject it. If there is some accusation, personal accusations, we reject it outright. But then beyond that, there are also quality issues that the speaker is not able to articulate, the call is very noisy, the audio is very noisy, and all of that are decisions we have to take editorially. Okay, so we were then able to see that with training. Okay, so with training users continually to how to make good contributions, how to speak on a phone, how to make the articulate and succinct statement in 2 minutes on a phone call. Okay, and we see that the percentage of uh, rejected content per user. These are users who have been calling for all the 4 quarters, all the 12 months. They have been calling at least once. Okay, that's the basic filtration criteria. We see that the the number of rejected contributions over time has gone down. That is, the if I make 10 contributions initially, if I were 8 of them were getting rejected, by that 4th quarter only 4 of them are getting rejected and 6 of them are getting accepted. So it's again a proxy indicator. We cannot absolutely establish causality, no doubt, but it's a proxy indicator of that because of the training, more and more of the users are able to make better contributions over the platform. Okay, and this is again independent of the maternal nutrition and health or child nutrition and health. This is I think this holds true for any platform or any context where we are trying to adopt or trying to promote a new technology among absolutely new users. Okay, then okay, so this is kind of trying to show you the differences. Okay, so the next thing that I go to is the reason or the why should we have content diversification. Okay, the reason is, let's try to get to it. Okay, so we conducted a phone survey. A phone survey is again an IVR survey, so you can have questions and you can have 4 options or 2 options and ask people to press buttons. Okay, so the phone survey revealed that there was a certain self selection. Only women who were pregnant or who had infants in their house, in the family, they were participating on the platform. The others were not participating. Okay, so this, but we wanted to promote intra household and SHG level and family level and community level discussions on nutrition, a holistic behavior change, not only a change in mindset for the people who are currently pregnant or have infants in their house. Okay, so one way to do that, and the reasons we found out, of course, again, we had phone surveys, we had qualitative surveys, is that people didn't find the content on the platform relevant. Okay, so then we asked them what are the relevant contents, what would you want to hear. People said that we would want to know about news, local news, children's education, agricultural advisory. If you give us these things on your platform, probably will participate. Okay, so then we took a decision. Okay, at this point we need to diversify our core content. So then we came up with this terminology of core content and non-core content. Okay, and this table kind of tries to summarize that. Okay, uh, in quarter 3 and quarter 4. Okay, and again in male and female. So what we see is that although after the diversification, so this is again a proxy measure. Skipped after listening to 80% is a proxy measure that we use. Okay, so the so you can press 1 to skip a content, right? So I told you when I was trying to explain mobile man, you can press the button 1 to go to the next content. So when you go to the next content, the assumption is you didn't like the current content, and so therefore you moved on to the next content. Okay, so so and then again 80% is where we say that if someone has listened to 80% of a content, it's mostly the person has been communicated the idea about the content, and we can count that as a listenership. Okay, that is the kind of, again, thumb rules. There's no absolute mathematical basis to select this 80% or anything else, but these are thumb rules were used in this project. Okay, so we see that there is a It's people who skip content after listening to 80%, there is a rise in quarter four compared to quarter three. But we don't see a lot of difference in the female users, but in the male users, we see that in quarter three, for the core content, we have a 7.7 percentage point difference, and for non-core content, we have a 10 percentage point difference. Okay, so the conclusion we can make is that definitely we have more male users listening to content, but it's not like it's the male users are only listening to non-core content. Male users are also now accidentally listening to core content. So this is again a concept in communication of accidental learning. So you give people what they want to consume, but in between also you give people content that you want them to, or the program wants them to consume. So while consuming something that they like, they accidentally also consume that's something that you would want them to consume. Okay, so that's again the thing that is happening here. Okay. uh, then the second, sorry, this is trying to highlight the differences. Okay, the third part that I'll highlight is again the reason and the importance that any interaction medium or any program interactive platform that you would try to deploy, why should you have a mechanism for concurrent monitoring? Of course, concurrent monitoring is important for ground money because it has to convince the funders that whatever you have funded us for, we have results, and therefore we can go to another funding agency or the same funding agency for more funds, right? But that is, of course, that's true for any program. But other than that, concurrent monitoring helps us tweak or improve the program as it is going on, because it gives us continual feedback on the kind of work we are, the uptake or the impact of the work, or the how is the community reacting to the content that we are serving them. Okay, so and the concurrent monitoring, and these are actually standard terms that if you use something like a log frame or something, this is all again it comes from a very development organization kind of a setting where you have log frames to monitor and evaluate your impacts. Okay, so the three scales which is usually monitored are the inputs to the programs, the outputs from the program, the outcomes from the program. Okay, the inputs to the program is something that you are putting in, you are creating content, you are doing trainings. Okay, so and the outputs is like what is the immediate kind of change that you see because of your input. Okay, so maybe a spike in the call rate, a spike in the contribution by users. Okay, but the outcomes are something more more holistic, where you would want to see, because of the spike in the call rate, or because of the spike in the number of callers, because of the spike in the contributions made by callers, what kind of behavior change, because that's the ultimate goal, right? So what kind of behavior change are you even seeing in the community? Okay, so what just I'll try to highlight what are the different parameters we try to monitor in the inputs, outputs, and outcomes. Okay, so the inputs is the number of trainings with the number of attendees who have brought the phones. Okay, the quality of discussion that is happening on Mobile Vani, around Mobile Vani. Okay, the calls and contributions made by the community managers themselves. Okay, so we were able to identify the active and inactive CMs using this. The outputs are the number of calls that are coming in from the community. So that's a kind of an indicator. Are the trainings, we're doing trainings every month or so, or maybe every week, whatever frequency we decided, right? Are they even translating to calls to the system, or are people not calling after the training? Okay, then the skip rates, right, for different themes, and the number and the quality of the UGC, or the user generated content. Okay, which kind of tells us what themes and formats are resonating with the people, what themes or formats are people not liking or not getting, and therefore skipping, right? And the outcomes is the kind of the behavior change or the perspective change or the societal change that you wanted to bring about, right? So you want to test the awareness levels of people, and I'll just come to the what are exposed and unexposed in the subsequent slides. Okay, then there you have also UGCs. Okay, user generated content, which the people are contributing. Now, is the UGC showing a shift in behavior, like the drama I was talking to you about, a mother-in-law, a son, a housewife, or a daughter-in-law and a child, right? So you ask people, what should the mother-in-law do next, or what should the daughter-in-law do next? And do you, with these questions, are you able to map a change or shift in the thinking and the behavior of the people, right? So again, I mean, there's also something called a theory of change that we usually build. So just because people are saying the mother-in-law should act in a certain way, or I feel that I should act, if I were in her place, I would act in a certain way. Does this actually change just the awareness? Does it bring a change in the actual behavior? Okay, so that is also something that can be monitored using surveys and using follow-up questions. Okay, so of course there is awareness change, and then there is behavior change, which is the goal that we want to get to, right? So just a few slides on, and these are examples. There's a lot of parameters that we're monitoring. So we were able to monitor which were the very active CM, very moderately active CMs, and also the less active CMs. So it's like a representative graph of that. And then the inactive CMs, then we reported to GVK that these CMs are not participating, and we're able to push them additional training modules. Okay, so that they're motivated, or they are pushed to be more active in the program. Okay, then there's this outputs is one example of outputs that we're trying to see. Okay, and the thing that we were one of the things that we identified is that what themes are working, what themes are not working. And one example is family planning. We see a lot of skip rates. Okay, so this is a percentage of users who skip. Okay, and 80% and above is like listened rate. Okay, means 80% and above means people have listened to the content. 20% or less is like a skip. So if people skip before 20% of the content has been played out, then we consider that as a skip. Okay, so we see that there's a lot of skips in family planning. And then again, of course, that's quite maybe quite apparent, but also we did some surveys and found out that family planning topics are taboo topics in India, right? So you don't discuss family planning openly in your family, right? So if there is a community consumption of content, whenever there was some content on family planning, people would skip it. Okay, so because we had this concurrent monitoring going on, we were able to identify this very quickly, and then we reformatted the content. We still talked about family planning, but we talked about it in other terms. That the content team took a call on that to make it less taboo or less inappropriate for a family setting. Okay, so then we have the outcomes. Okay, so the outcomes we were monitoring using something called a knowledge, attitude, and practice survey. Okay, it's called KAP survey, and it's again a standard term of you have survey questions through which you want to monitor knowledge, that there's a change in the awareness, there's a change in attitude, and is there a change in practice. Okay, so these are the three parameters you can monitor. Okay, and what we did was there's because we were constrained by the funding agency parameters, we were not able to do a randomized control trial kind of a setup, right? What we did was a comparison between people who have consumed content and people who have not consumed content. So we call it exposed users and unexposed users. Okay, so the kind of comparisons we were able to get, and again this is an example, is that how can you check if the food is of the correct consistency? So this was one of the information that was conveyed using or through the campaign. Okay, and the what we saw that there was a certain difference between the responses. Correct response is this, the blue bar. Yeah, the food sticks to the spoon. If the food sticks to the spoon, then it's the correct consistency. If it flows out, then it's very dilute. Okay, so so you should make it thicker. Okay, and of course in a rural setting you don't have scientific measurement equipment, right? You have to go by ad hoc measurement techniques. One of them is that if you tip the spoon and the food, it should stick to your spoon. If it is not sticking, if it is flowing out, then it's dilute. Okay, so we saw that there was a certain difference between the awareness levels of unexposed and exposed users, and this again a proxy indicator that people who have listened to a content are able to or have been able to gain that awareness around this topic. But then there are other topics like this, like how many bowls of dal should a pregnant woman eat in a day? Okay, that's again something that was communicated over the content. Okay, the correct answer is this green bar. Okay, but we didn't see a lot of difference between the exposed and unexposed users, and this can indicate to and it's like that this bar is very high. It's only 34%, right? So what that indicates is that our content maybe is not good enough, or the communication was not good enough for the exposed users to know about this kind of this practice, right? So in those cases, we generated additional modules like did you know episodes, right? Small episodes. Did you know that a pregnant woman should eat at least one bowl of dal in a day? Okay, so this is like a reinforcement of the key messages that we try to do, and we were able to do this because of the this concurrent monitoring framework that we had set up, right? So whenever a content goes out, we're able to see what kind of interactions people are having on the content, and therefore can take actions. Okay, so the fourth axis of challenge that for to do this program was on the mobilization pathways. Okay, and again, this is a trade-off that I'll be talking about of using different mobilization pathways. And depending on what program you are doing, what kind of audience you want to reach, you can choose what percentage of what pathway you would want to use for your program. Okay, so this was this uh, the thing that I have been talking to you about till now was something called the SHG arm of the program, right? So where the primary interaction point or introduction point was the SHG meetings, the self-help group meetings, right? But then we also experimented with another arm called the non-SHG arms, where we don't go to SHG meetings anymore, okay? But volunteers, the Gramvani volunteers directly mobilize the end users either by visiting households or talking to them individually. So we're no longer going to SHG meetings. That is happening in parallel, but there's a two different blocks in the district. So not the 6 blocks that we already talked about. There's 2 other blocks, okay, where volunteers are going and talking to people individually in houses, the promoting the platform. Okay, so the first problem that we faced in this was that most of the Ramani volunteers are male. Okay, and this also a lot of work that we are doing on trying to study or understand why do women not participate on the platform, or why do women not volunteer. And some of the reasons we know, some of the reasons we're trying to discover. Okay, so only 20% of the users in the non-SHG arm are female, and this is a consequence of this. So volunteers are male. So and again, in a rural Bihar context, a stranger, a male stranger, if he or she comes, he comes to the house, the women folk are not forthcoming to talk or speak to the male stranger or male volunteer, especially on topics of children, family planning, pregnancy, and other topics. Right? The women folk don't talk to men about that. Okay. Consequently, the volunteers were mostly able to reach men in this arm. Okay, and so only 20% of the users in the non-SHG arm were female. Okay, but so again, we were trying to explore this volunteer model. It's probably not working, or the scale that you want to reach is not happening. So we introduced something called child journalism. Okay, so instead of going to the households, the volunteers now went to schools, and they told the children that this is a number. If you dial this number, you have educational content, because we're already doing educational content. Okay, so why don't you dial the number and listen to the content, and why don't you make your parents listen to it? Okay, and we did see that this was quite successful, where children were able to onboard a lot of the parents onto the platform. Okay, and we also saw that because of this 80% male usage, it's not like all of that was in vain. A lot of the learning that we ultimately came to know through the KAP survey is that through male members also a lot of transfer learning was happening in the families. Okay, so there are other challenges that we saw in the SHG versus non-SHG setup. So the SHG was a high precision, low recall setting. Okay, so we were able to target women with a high precision, right? So all the meetings were attended by women, but not all of them converted to users of the platform. Okay, so we're able to reach women, but SHG members attending the meeting are older and not open to adopting technology. So the utilization of the platform was quite low. In the non-SHG platform, however, it is even harder to even reach women. It's a low precision platform. Okay, so maybe recall is higher, but the precision in the non-SHG arm itself is low. So we are not even able to reach women. Okay. Then the other thing that we saw is that again, continuing from the low precision and high precision, low recall setting, that and this is an evidence of that the SHG members themselves, the red bars, are on the higher age group, right? So this is the highest bar, 31 to 40, right? But the platform users themselves were of a lower age group. So although the SHG women were participating or getting the training in the calls, and many of them were participating, no doubt, but we see that most of the callers were of a lower age group. So what was happening? Maybe the SHG members were going home and telling their daughters or daughters-in-law to interact on the platform. Okay, we don't have concrete knowledge of exactly what was happening, but we see this partition in the age groupings between the members, SHG members who were training, and the people who were actually interacting on the platform. Okay. The next kind of outcome or learning from here is the kind of the occupation in occupational groupings that the SHG and the non-SHG arms were able to access. Okay, so what the SHG arm, we see the red bar is labor, right? Labor would be farm labor, migrant labor, any kind of manual labor, right? So, and the yellow bar here is smaller compared to the yellow bar in the non-SHG arm. What this kind of indicates again is that the SHG arm, we have people who have agriculture as the primary modes of income, right? So most of the SHG arm was or SHG meetings are attended by women who do not have to work, or either their livelihood or food is being taken care of. It's either male members are working or they have farming, farmlands. Okay, so landed people who don't have to work for a daily living. Okay, but on the non-SHG because we're trying to target only through SHG, we're only able to access people of this demographic or this occupation. The non-SHG arm, however, because we went to households or through schools, we are able to also target a larger amount of people who are dependent on labor, right, daily labor for their occupation. Okay, so again, this is again a trade-off on what would you want to access and what would you not want to access. Okay, so the SHG, the migrant and labor-dependent families might not be attending SHG meetings, and in the non-SHG arm, we're able to reach more labor-dependent families. Okay, so this is kind of the challenges and the trade-offs that you would kind of expect in if you were trying to do such a program. Okay, so this is the last slide now. Try to conclude or summarize what I've been talking about. Okay, so the first is, of course, technology adoption is hard when you're doing a new platform for users who have not used or not keen on using technology. So it takes time and it needs continual persuasion, training, and nurturing to even build the culture of a shared phone usage or interacting on the phone, contributing or talking on the phone. Okay. Then we also saw that if we are able to diversify the content, then we are able to deepen participation across genders, and it avoids self-selection of participants on the platform. Okay. The third point was that concurrent monitoring, of course, helps us in improving the implementation of the program while still the program is still ongoing. And the fourth point was that on the mobilization, where it's hard to reach women users in general, but SHG users is a SHG pathway is a good pathway to target women. However, the SHG might miss out on marginalized groups which are dependent on daily labor for their living, because they might not even have time to attend SHG meetings. Okay, so that is what I had to say, and maybe if you have doubts, questions, we have some time, I think, to that. Right? Yeah.
I have a specific question based on observation. Hello, sir. Thank you for the talk.
Yeah.
So my question is based on a personal observation rather than your slides. So after the alcohol ban in 2016,
Okay.
a lot of the households, a lot of the alcoholics turned to tobacco and other smokable objects.
Okay.
Drugs.
Okay.
So were there any awareness material given out in this regard, how smoking these substances in front of children or in proximity to children might harm them?
No, not that I'm aware of. Not in this program. We didn't do this. But then there are other campaigns where we try to target other social labels like, of course, addiction, then dowry, child marriage, early marriage. But not in this program. We didn't target any alcoholism or tobacco usage.
So in a lot of the households as well, so they brew their own alcohol within the
Correct.
house,
Correct.
and sometimes children are also they come in contact with this homebrewed mixtures.
Correct.
So
Yeah. So yeah, and I'm sure that that is one reason where the maybe the money, the limited money in the household is going towards or being spent in addiction when it could have been spent on better nutrition
right,
or better education, right? That is true. But in this program, we were constrained by the parameters given to us by the funders, right? So we could only work in that limited scope, and we didn't go into those parameters. We were just targeting better nutritional practices in terms of how often should you eat, what do you do when you have diarrhea, okay, what's the frequency or what's the composition that a child should consume food, and all of those kind of vaccinations, the social entitlements like the Janani Suraksha Yojana, ICDS program, only
so
those limited scope. Yeah.
so was there any guidance given regarding how much money should be spent or how much um, resources should be spent on a child?
I don't think that we did that because again, the the entire scope was that within the affordability of a family, within the affordability, how do you change the behavior? Like instead of just the male or the boy child eating, you could have equal share between the boy child and the girl child. Or if a woman is pregnant, then what is the share of food that that woman should have along with the other male members? Within the affordability, we didn't try to scope out what money you should spend.
Thank you.
Yeah.
Any other questions?
I had one.
Yeah.
Yeah.
So this was when you were during the presentation, you were saying something like technology alone does not solve every problem
Mhm.
and can be used as an additional layer to societal problems.
Yeah,
So I
yeah.
was thinking, so should designers today think more in terms of entire service design approach to the problems and not just be obsessed by interaction design in itself? Because a lot of what I see lately is solutions in the sense an app that will basically fix all the problems, which is usually not the case.
Yeah,
And
yeah. So, I
even
mean,
mirrored in the research papers that I read or what
hmm.
there's online.
Yeah, yeah. So there's a entire ICTD literature, which of course, 10 years ago, even ICTD researchers would think that technology is solution for all problems. But the field has matured a lot, and now people realize that. So I'm a computer engineer, so building an app for me will probably take a month, right? But that will not solve any problem that I'm targeting. So unless I have the other parts where technology, training on technology, convincing people to adopt technology, monitoring of the technology, the pathways to mobilize on the technology. If I don't have all those in place, the content that goes about the technology platform, if I don't have all that in place, it will not work. Design, interaction design is one part, but it has to be coupled with the other parts as well. So there's a lot. If you just go to the ICTD conferences or the ASIM Compass Dev conferences, there's a lot of literature on people just saying this, that technology is not and also Kentaro Toyama is, if you've heard of him, he's the founder of Microsoft Research in Bangalore. Now he's in Michigan. He has an entire book on this. The technology is not the solution to problems.
Any other? Yeah.
I just had one. Uh, Thank you for the great talk. I just had one question. Of the
Yeah.
four things that you talked about
So which
that
thing, sorry?
are used in the program, technology adoption, diversification of content, and all that.
Yeah.
So do you find that one of these was more effective in the behavioral change than the other, or is it difficult to quantify? For example, did you find that concurrent monitoring was something that really helped towards behavior change? Uh,
There are individual, of course, individually, all of them help, but yeah, it's like if you try to compare them, maybe it would be apples and oranges. I'm just, again, I don't have any data on that, so I'll probably not say in a very confirmatory tone, but I'd probably be comparing apples and oranges if you try to compare contributions of concurrent monitoring versus contributions of mobilization pathways. Maybe the only thing you can see is how do you even quantify that? I mean, establishing causality is a very big problem, I think. Again, I'm not, because I don't have data, and I'm just guessing in this case.
Yeah, so if there was any qualitative feedback that came in from the field where you found that this probably helped get just some anecdotal.
I mean, the qualitative feedback from the field would be on the content itself. That I like the program on say family planning, or I like the program on complementary feeding. They didn't know that this concurrent monitoring was going on. There was an active push for mobilization, or there is an active push for technology adoption. That was not apparent to the user. The users were consuming content. Okay, so they would give us feedback only on the content.
So yeah, but I don't know.
Does that answer the question?
Yeah, to some extent. So the users may not be aware of concurrent monitoring, but did any of the people who are in the field who are sort of coordinating the program give any feedback that this?
Sure. Yeah. So of course, means we know that of course it helps. That there is no we have not quantified it, but of course when it helps us tell the field people, right? So they have these apps, ODK apps, through which they collect data and they get reports every, I think, a monthly or week. There are different reports: daily reports, weekly reports, monthly reports, quarterly reports, which they keep receiving. Okay, and of course we tell them that the number of calls from this block is down, so they have to do something about it, or the number of interactions on this theme is low, so content team has to do something about it. Okay, so those, all of those are there, but there's no quantification of how much it has helped, or has it helped more than some other access.
Okay, thank you.
Okay.
So Dipanjan, I had a couple of questions to ask.
Yeah.
So one was, so first of all, of course, thank you for a great talk and thank you for sharing your experience with us. You guys have been doing this for a long time. That's brilliant. So one was about what you presented. You briefly mentioned saying that there is a bit of a learning curve in learning to use these IVR systems. So, and that, although you said that interaction design is not that important, I think that is
No. I didn't say it is not that important. It's very important, but there are also other important factors.
right. That is somewhere actually a lot of, I mean, because you mentioned that, that a lot of people cannot actually go through, I mean, cannot use even IVR systems.
Yeah.
So first of all, did you try to, explore alternative design ideas to see which ones are better, or like alternative scripting ideas? Like some of the work that we had done, for example, we thought that we found that, if you tried a different script, it is more likely to work than.
Yeah, so scripting means content-wise, what prompt users respond to more, that we have tried in this program, and because it has been running for since 2000, at least 2012, we have a lot of experience in all of that. We have done all of that, but the exact technology-wise, it's a little rigid, because if you want to change the technology or the kind of flow of the call, then it would take a longer cycle.
I didn't mean flow. I meant things like, what is the nature of prompts? Like for example,
all of that we have experimented with. We don't have the data in this slide, but it has not only this program, but it is cumulative experiences or learnings from for years, 5 to 6 years now on similar things. We have done that. We have we do that work. That is what we do. Yeah.
Okay. And I had a second question regarding your new role in Hyderabad BITS Pilani,
Okay.
Hyderabad campus. What are how do you see the future of this field, and how do you see us going forward? Because, so this is something that you've been working for a long time now, but the technological climate keeps changing and evolving also. And so, if we were to, like, we are in 2020 now, and so if you look at till 2030, for example, the next 10 years, we should start working towards those next 10 years now. So how do you see the sectors evolving? What do you think should be our priority as ICTD researchers, as designers, as computer science people, as other people from other groups? How do you see this field evolving, and what do you think is?
I mean, so again, I don't have data on this. Again, this hunch or my intuition that technology is, of course, rapidly changing. We had IVR, maybe we have Android penetration is high. Maybe in a few years, IVR, the reason to have IVR might even disappear and just completely shift to Android. Okay, but what is not changing that rapidly is the capabilities of the users themselves. So even if the shift to Android, I think voice will still be important. Okay, so text literacy is not going up anytime soon, or People, even if they use WhatsApp on smartphones, they use the voice message feature, means they record and send, and also get a reply on recording. There's not a lot of typing. Okay. And even on Facebook, you see a lot of consumption, but not a lot of people creating content. They post pictures, but you don't see a lot of text. Means again, depending on the community. In my friend group or your friend group, maybe people are writing. But if you go to a community which is less text, not text friendly, then you'll see there's lots of pictures, a lot of videos, but very little text. Okay, so I think non-text medium is going to stay. Maybe the underlying technology will change, and we have to adapt to that. Today we are still doing IVR with Gramvani, but even in Gramvani we are building an Android app. But on the Android app, it's completely audio. We don't have a lot of text interaction. Okay, because we realize that these people are coming on the smartphone ecosystem, but they're still interacting over video and audio. So that is going to stay. That's kind of, again, I don't have data, so again, an intuition that, and because of this intuition, so currently I'm starting to create some projects on voice bots. Okay, so and more intelligent voice bots. So this is an IVR that is very static, right? So you press one, you go there, you press two, you go there, but there's no decision happening. But because of AI technologies, machine learning technologies, kind of exploding around, right? So you can put AI, you can put dump data to any black box, and it will give you some kind of a pattern. Okay, so why not use that to design intelligent systems? Where can a farmer come on my system and ask, what is the fertilizer and this is a very crude example, what is the fertilizer I should use for say rice? Okay, and the system should be intelligently over voice respond. Okay, and the farmer is asking over voice, and the system is responding over voice on a voice bot, chat bot like platform. Okay, and there is no static coding of rice equal to this fertilizer, wheat equal to this fertilizer, but there's a knowledge base where machine learning algorithms are running, and we're able to parse that sentence that the farmer has spoken, identify entities, that rice is an entity, fertilizer is an entity. In my knowledge base, where do I have an answer for that, and give that answer back to the farmer? So that is kind of where I see the future moving. Is we will still have voice interaction. The medium of interaction will be voice. Platforms will change. Backend technologies will change.
Okay. So thank you very much, Dipanjan, for taking out the time today and giving us your insights. It was lovely to have you, and hope to get you physically to IIT Bombay at some stage.
Sure. Yeah, I love that.
Yeah, and that will be lovely. And maybe see you at India HCI later in the year.
Yeah, sure. Thank you so much. Lovely interacting with you. Yeah. So in case you have any questions, my email ID is at the bottom of this slide. So you should definitely write to me.
Yeah. Thank you.
Thank you.